welcome to the Shatkin F.I.R.S.T Monday Morning Minute. Good morning and welcome to the Monday Morning Minute. Today we are joined by Dr. Rick Redmond from Alabama.
Yes.
What's the name of the town down in Alabama?
Sylacauga. We're Southern Smiles of Sylacauga.
Southern Smiles of Sylacauga.
Yes.
Alabama. So Dr. Redmond's up shadowing Dr. Shatkin today and learning some things from Todd. And I know you guys have done a lot of implants today. Tell me what dental school you went to, Rick.
I went to UAB, University of Alabama Dental School at Birmingham, and 100 years ago. Graduated in 92.
Okay.
So did a one-year hospital dentistry residency actually out at University of Washington in Seattle, and then started practicing in 93. I bought my great uncle's practice. He was ready to retire.
Gotcha.
When I was out of school.
So you went into his practice and you started off. And at first, were you placing root form implants, or what? Were you doing any implants at all?
I wasn't doing any implants for a while, and then around 2000, well, I did delve into the M-Tech ones around 2000, but I didn't have the confidence, nor, in my opinion, you didn't have a lot of support. Like Shatkin's great on that. I mean, any questions.
He gets back to you quick, doesn't he?
Yes, any problems, any questions, anything, yes, you can find the answer. So it's been much better. But I did an implant residency and learned how to do the root form, the traditional. Okay. And I was doing those for a number of years. But then I met Dr. Rhett Eklund, and he was so enthusiastic and positive about these. I just had to come up and hear a lecture, and I started doing them in 2019, and that's all I do now because I've had such good success rate.
And you were telling me that with the conventional root form implants that you were doing, that you had you weren't too happy with the success rate of some of the larger wide body implants.
That's correct.
Could you elaborate on that just a little bit? And
I would tend to have the most trouble on a lack of osseointegration in places that I'd grafted. So I'd extract, graft, let it heal, place the implant. And some of them were crazy. It'd be like 6 months or a year later. You know, you've already restored them, they got a crown on them, and then the whole thing's loose. And it just, I don't know.
It can get frustrating.
Yes, and I have not had that with these one-piece tissue level.
That's right.
I've not had that issue. I think the stability that you get right off the bat makes a huge difference.
And I mean it's nice that it's one piece, and you're not using a drilling sequence most of the time. It's just one drill and one implant.
That's right.
So down at your practice, you're one of our mini dental implant centers of America.
Yes.
And how are the patients finding you? Like how do the patients hear that you're doing these type of implants in your office?
Well, we do a few different types of marketing. We do the infomercial that's shown. We've got a local station, but they're actually networked statewide. We do play that infomercial out of Birmingham. We're about an hour out of there. We do some direct mail from time to time, and then of course online.
Right. Okay. And you're referring to the infomercial that Mark shot for you.
That's right. Shot up here.
Yeah. And at lunch today, you were telling us that you had a patient drive a couple hours, huh?
I've had them drive up to 4 hours. I would have never imagined it.
Incredible. And how long was he watching your commercial before he decided to come into?
This guy that just drove, like 2.5 hours. He said 2 years.
2 years.
He was watching it. Yes.
So you never know when somebody's going to respond to the commercial.
That's right.
Yeah, that's phenomenal. So how's your staff? Did the staff pick up when you came back after being up here and learning about this minimally invasive procedure?
Right.
Did they pick up on it right away? Did they have your enthusiasm, or how did that go?
They did some, but back then, 2019-20, y'all had some marketing people up here, and they came down, and they really did a good job spending a day with the staff, explaining everything, because even though, the dentist comes back from these meetings all enthusiastic, and they've seen that a number of times, so I don't always get enthusiastic right off the bat.
It takes a little bit of...
Yeah, that's right.
Okay, I got you.
Yes.
Can we talk a little bit about the shadowing today?
Oh gosh, yes.
Yeah. So could you tell me what you saw today with your day of shadowing?
I've brought a notebook, and I'd been making over the last couple of months a list of questions, and I mean, Todd's been great to make sure we got all those answered. I've brought a few CTs for him to look at, but for me, it's been very, very beneficial because I've been placing these for a while, and so you do run into some challenges from time to time. Mm-hmm. Yeah. So now that you've been doing it for a while, and then to get to ask Todd those questions and see him deal with some of it too.
Yeah.
It's just because I can tell you, like I said, I placed traditional for a number of years. Every system is going to have problems that come up.
Yeah,
I mean,
absolutely.
That's just, the human body's just too complex. But I've had way less issues. And like I said, you got all the support you need when something does come up.
Yeah. And I'll tell you, the way that you brought all those questions in, I saw your composition notebook, and you had it all. I mean, that's a great idea. It really is. It's because I know once you start placing the implants, you're going to have question after question after question, and it's good to keep a journal on it. And that was a smart way to do it. Yeah. Yeah, so not only do you see Dr. Shatkin when he's placing the implant, but you see like if there's an issue that comes up or some type of problem that he's got to get around, it's always helpful to see that too.
Very much so.
Yeah, that was great. Dr. Redmond, thank you so much for being on the Monday Morning Minute this morning. It's great to have you up here in Buffalo with us. You're welcome anytime, of course.
Thank you.
And I also want to let everyone know that we're going to have our intro course on September 20th and 21st. It's a Friday and a Saturday. The course is filling up, so be sure to call. You can call 1-888-4-SHATKIN, or you can go to our website and sign up at ShatkinF.com. And later this year in November, we're real excited about having Gordon Christensen coming back to join Dr. Shatkin and our team up here to lecture on the benefits of mini implants and how we use them. And Dr. Matthew Lasorsa will be up for a full day of problem solving on Saturday. So be sure to sign up for all 3 days, and we'll get you more educated, and 25 will start off on like gangbusters. We hope you have a great week placing mini and mono implants. Again, Dr. Redmond, it's great having you with us on this Monday Morning Minute. And we'll see you next week on the Monday Morning Minute.